अनम्यूट म्यूट कर दे.
Okay, Shaiti, we are live. Yeah. Okay. Good evening, participants and delegates. Thank you for joining Shield Connect. And today we have a doctor from Telangana, famous doctor, Dr. Reeta Agarwal. And ma'am has already presented many webinars with us on Shield Connect. And today ma'am is going to take a new topic on Shield Connect page, that is stress, infertility and stress management. So before I start with the session and hand over to the ma'am, let me give a brief introduction of our speaker, as well as I want to give a little introduction of our page Shield Connect. So let me share my screen. So this is our page Shield Connect. You have to just connect to shieldconnect.in. You can see all the sections are available. The first section is the blog section, where you find all the blogs that are written by the speakers, eminent doctors who are connected with Shield Connect. Then we have webinar section, where you can find upcoming webinars and past webinars. So if you click on upcoming webinars, you will see the today's webinar as well as the upcoming webinars that are coming in this month. So when you click on see more, you will able to see our webinars, which is going on live right now on Shield Connect page as well as on our YouTube page Shield Connect. And participants, if you have any queries on our today's topic, you can post your queries in this comment section. So at the end of the webinar, we can have a Q&A session with our speaker for the day. Then we have awareness pages like PCOS awareness page, menopause, GDM. So if you click on any one of the page, you will find all the videos regarding the awareness of that topic. And we also have our leader section, where you can find all the speakers and doctors who are connected with our Shield Connect. So you can also go through their profiles on this page. So now let me introduce our speaker for the day, Dr. Reeta Agarwal. So ma'am has done MBBS, DA, DNB in obstetric gynecology, fellowship in infertility, laparoscopic surgeon, and SIM. Ma'am is currently clinical head of Kavya Infertility Center in Hyderabad. Ma'am life membership is IMA, Foxy, IMS. Ma'am has presented various papers in national and international conferences and have published many articles and many publications in both national and international journals. Ma'am is one of the founder member of INSPCAN, Indian National Society for Prevention of Child Abuse and Neglect, an active organization looking after the child abuse cases in Nagpur. The area of interest is adolescent health and infertility. Ma'am has been awarded with many awards for like Best Student Award in school in Haryana. Dr. APJ Abdul Kalam Health and Medical Efficiency Award from Hyderabad High Tech City. Seva Ratna Legendary Award by Karunya Welfare Society. And Mega City Naukala Vedika Women Excellency Award on International Women's Day in Hyderabad. And Best Second Paper Presentation at Conference in Oncology, Retrospective Study of Increasing Trend in Colorectal Carcinoma in India at Annual Conference of AROI Oncology Millennium in 2002 at Sevagram, Maharashtra. So I welcome ma'am for today's webinar, and I hand over the session to you, ma'am. Thank you so much.
Thank you, Nishant, for the kind introduction. So good evening, one and all. Today I'm going to talk on about stress and infertility and its management. So all of us know very well that nowadays stress is increasing too much, and it is one of the common cause of not only infertility but also many of the medical disorders. We all know that stress causes infertility and infertility causes stress. In fact, it is vice versa. So it's very important to deal with the patients, how to counsel them and to relieve the stress so that the outcome of the infertility will be better. So what is stress? Stress affects fertility, but people were unable to discover why and to what extent it is. What is stress? It is the reaction people have to the excessive pressure or the type of demands placed upon them. It arises when they are not able to cope up the situations. Our body's physical and emotional reaction to circumstances or events that frighten, irritate, confuse, or endanger or excite us, they all will cause stress. Stress is a part of life. The good news is that stress can be self-controlled. It prepares a person to react to the causing event or stressor. The positive correlation have been found between physical fitness, social support, emotional well-being, and health outcomes. Nurturance is the another factor that affects the way people handle stress. There are different types, like it will be physical, social, or psychological. Physical means maybe because of some external factors. Social, that is caused by interaction between the individuals and the his or her environment. And psychological is nothing but the strong emotions can be brought on by the external or internal factors. So response to the stress, it may be fight or flight. Either we have to fight it or we can flight. So what are the response to the stress? It will be like heart rate. We all know from the MBBS level that our heart rate will be increasing whenever there is a stress or when we are feeling stressed out. Blood pressure will rises up. Breathing become rapid. The hormones, that is adrenaline, increases and senses become more efficient. Muscles become tense to enhance movements. Blood flow increases to the muscle in the brain and decreases to the organs, hand and feet, and there is perspiration. So the symptoms, it may be intrusive symptoms, negative mood, dissociative symptoms, avoidance symptoms, and arousal symptoms. And like patient may complain of heart in like palpitations, chest pain, difficulty in breathing, nausea, fatigue. Some will complain, I have stomach pain. Like whenever they are stressed out, they will complain differently. Like some will complain they have headache, sweating, and some will respond to stress in the form of like they will start smoking, they will take alcohol, some will start biting the nails, and they will have disturbed sleep, and some people will eat more during stress. Like we have seen many patients like during the exams, because of stress they will start eating and they will gain weight. But opposite to that is some will start eating less because of stress, they cannot eat properly. So the symptoms will vary from person to person. How the stress can lead to infertility? It can affect both male and female partners. Like it will affect the sexual function, like causing the sexual dysfunction. It may cause hormonal imbalance. And in the sperm, it will decreases the count, motility, or structure. They may alter. And that may be the one of the cause for infertility. They will have disturbed menstrual cycle pattern, maybe regular, or sometimes because of stress, they won't get menstrual cycle for 2 to 3 months or maybe 4 months, like that. Because of stress, it will be altered. And stress may also affect implantation. And so all these factors, they will negatively affect the IVF outcome. So whenever the patient is diagnosed with infertility, they will react to the diagnosis in different manner. Like some partner will experience several emotions, like few patients, they will have suddenly they will be shocked of knowing the cause of infertility. Some will be surprised. Some will be like they will deny, like they have the sense that the diagnosis is not really true. So this can be described as feeling numb or not knowing what to do. As some will react in different way, like they will have anger, like some will have frustration, and some will have anxiety and fear. Like some will become panic suddenly, and they will be confused. And some people will be like they will be feeling isolated. That will be like everyone will be behave differently to the situation. And there will be sense of loss. Then there are many aspects of grief covering loss of pregnancy, loss of motherhood and fatherhood. These can continue throughout all stages of infertility, not only from the diagnosis but also from the like stimulation, pickup, and embryo transfer, or even in the next coming ways, like when they get pregnant, also in the trimesters also. Impact of stress on fertility. Infertile patients respond to the stress of being unable to conceive by aggressively pursuing the treatment and procedures. They withdraw and isolate from family, friends, and community. Most of the people who cannot get pregnant have an actual physical explanation. But as month and after month passes, like as the time passes, there are feeling of stress, anxiety, and depression. Even if the physical cause of infertility is being treated, like for example, if you're like for some patients, they have underwent surgery, like for endometriosis, or for the male factor treatment, like they have low sperm count or any other thing, still it is possible that high level of stress can still make the patient not getting pregnant. Like pregnancy will be difficult because the simple cause, that is stress. Infertility, it causes stress which is aggravated at times passes and the couple remain infertile. The couple participating in an IVF program are highly stressed, especially after a failed IVF cycle. So during IVF procedures, like there are many times when they feel often they have to take off from their offices to get the appointments. Whenever we are taking their blood sample for investigation, when they have internal examination, or when we are doing ultrasound, internal ultrasound, that is transvaginal scan, or whenever they are getting injections, and like whenever when we are stimulating the patient, or whenever we are telling for the timed intercourse, like for that reason also, like they will be stressed out, like if we won't have intercourse on the particular time, we won't get pregnant, and various other diagnostic procedures. And last but not the least is the financial factor, that is cost factor. So we all know that stress releases the because of the oxidative stress, there will be DNA damage that will affect the number, motility, and morphology of the sperm, and it will cause the male infertility. So what are the factors? Not only stress, but also like high fat diet, consuming too much of coffee, alcohol, or smoking, or low physical activity, and consuming low fruits or vegetables, and uh, having the high temperature, like most of the people who are taking hot bath for the longer time, or working in a like hot environment for the longer time. So all these will affect the male infertility. According to American Society for Reproductive Medicine, infertility affects men and women equally, and semen quality is the key indicator for male fertility. Men who feel stressed are more likely to have lower concentration of sperm in their ejaculate, and sperm, they are more likely to be mishapen or have impaired motility. It may trigger the release of steroid hormones called glucocorticoid, which in turn could blunt level of testosterone and sperm production. Another possibility is oxidative stress, which have been shown to affect the semen quality and fertility. So in the last slide, we have seen that because of stress, there is a release of glucocorticoid. So these will all causes increase in apoptosis and cell cycle arrest, that will cause decreased spermatid and spermatogenesis, that they will affect the process of spermatogenesis, and there is decreased sperm concentration. And in the oocyte quality also, it affects like environmental changes, pressure and demands, and several other factors that generate psychological stress. So psychological stress induces lifestyle changes and cortisol production from the adrenal gland, and which will affect the ovarian physiology either directly or indirectly. The lifestyle changes like alcohol consumption, smoking, all will lead to increased level of ROS. This increased level of ROS result in oxidative stress. The increased cortisol as well as oxidative stress, they will affect the granulosa cell function, and it will cause apoptosis. So all these factors, it will deteriorates the oocyte quality, leading to poor reproductive outcome. So this is nothing but the diagrammatic representation what I have told previously, that because of stress, because of various factors, it will increase the ROS, and another, it will increase the cortisol level. All will causes the granulosa cell apoptosis. This will cause estradiol level and reduce growth and development of oocyte, and overall it will affect the oocyte quality and poor reproductive outcome. Stress also affect the endometrial receptivity. Human endometrium, it plays a very important role in providing the site for embryo implantation and maintaining the normal development and survival of the embryo. So recent studies have shown that stress is common factor for the development of unexplained reproductive disorders. So if the endometrium is not receptive, and there may be disturbed early feto-maternal interaction, which might lead to infertility, including the repeated embryo implantation failure and recurrent spontaneous abortions or late pregnancy complications, thereby affecting the quality of life as well as the psychological status of the affected individual. So stress not only affect the starting phase of infertility, but also as the pregnancy passes on, it will advance, it will affect each and every stage of the pregnancy also. So this is nothing but the same what I have told you. That's because of stress, there will be hypothalamus pituitary axis disruption. So there will be decrease in GnRH and increase in follicle stimulating hormone. So in the ovary, E2 and P4, estrogen and progesterone levels are altered. So because of decreased lower GnRH, lower FSH-LH ratio, altered secretion of E2 and P4, inhibition of endothelial and stromal cell proliferation, inhibition of stromal cell differentiation, altered the endometrial gene expression, and it will cause impaired endometrial receptivity. So it will overall affect the embryo implantation and its development. The primary endocrine component include HPA-axis and locus ceruleus norepinephrine autonomic nervous system. Within a few minutes of stress, there will be activation of HPA-axis, which will cause release of CRH, which in turn stimulate the corticotrophins in the anterior pituitary, and it will release ACTH. And when the brain detects a hemostasis challenge, it activates the sympathetic nervous system, releasing the catecholamines, that is epinephrine and norepinephrine, resulting in the physiological stress response. Stress, it can interfere with reproductive function at all level of reproductive axis. It starting from like it inhibits the sexual desire, reward, and mating behavior at the brain level, especially in the ventral and tegmental area, interfering with the release of GnRH pulse generator in the hypothalamus, as well as LH and FSH release from the anterior pituitary. Different stresses are known to activate different pathway, different durations to affect our health, and the stress adaptation response to affected by the dominant role of certain sex steroid in the circulation. So studies have shown that acute stress can inhibit the HPO axis by inhibiting the secretion of GnRH, thereby inhibiting the release of pituitary LH hormone. So when lot of problems keep coming, our HPO axis, it gets activated to try and help us to cope with the ongoing stress. So activation of this HPA axis, it results in increase in cortisol, which is our main stress hormone, which raises our blood sugar levels and blood pressure and inhibits our immune system. High cortisol levels are linked with anxiety, and cortisol also inhibits testosterone, the primary male sex hormone, which is responsible for sex drive, that is libido, and it might contribute to the blood flow changes that causes an erection. Already I have told you that stress affects our menstrual cycle. So how it affects is high cortisol that is generated because of the stress. It dampens the hypothalamic GnRH secretion, which is responsible for triggering the pituitary to release FSH-LH, indirectly telling the ovaries to decrease their production of estrogen, progesterone, and testosterone. Similarly to its effect on GnRH, cortisol also directly inhibits the production of FSH and LH in the pituitary in a further attempt to thwart the change of ovulation and potential pregnancy. As a result, over time, the production of estrogen, progesterone, and testosterone goes a little haywire, thus disrupting the entire menstrual cycle. The psychological impact of infertility, that is depression, anxiety, and distress. The medication which are used to treat infertility, like we are using the stimulating drugs, gonadotropins, and ovulation induction drugs, all will cause symptoms like anxiety, depression, and irritability. The further into treatment a patient goes, the more often they display symptoms of depression and anxiety. Patients with one treatment failure, they are more prone to have more level of anxiety and stress. There have been dozens of studies which have investigated the relationship between psychological symptoms prior to and during ART cycle. It has been observed that more distressed women prior to or during treatment, the pregnancy rate is less as compared to the non-stressed women. And women in the higher quartile of alpha amylase level at baseline were twice as likely to subsequently experience infertility. And cortisol, which was measured, it was shown that during the stress level, it correlates very well with the pregnancy rates. According to ACOG studies, it reveals that anywhere from 10% to 25% of all clinically recognized pregnancy will end in miscarriage because of stress. Patients who experience a pregnancy loss suffer from post-traumatic stress disorder, which leads to anxiety and depression. So repeated pregnancy failures or repeated implantation failures, some patients will get pregnant quite easily from ART, conceiving on their first cycle. However, there is exceptional For many, it may take years, and for many, it will they may be in the first cycle. The cause of infertility is not always clear. It may be an underlying health condition such as PCOD or endometriosis or male factor, or sometimes frustrating diagnosis like unexplained infertility without any cause. Knowing the root cause of infertility diagnosis can reduce the burden, but still it can help. They can place blame on the something. Patients with unexplained infertility do not know why they cannot get pregnant. They may become obsessed with their diagnosis. In fact, infertile women may display a high prevalence of obsession. So what are the way to reduce stress? So we should counsel the patient, like they have to keep talking to their partner, tell their concern. Remember that you are not alone. We have to counsel in every visit that you are not alone. Your family members are there with you. We are there with you. So these are the simple ways to reduce their stress. Talk to the people with infertility through individual or couple counseling, or through their group support group. Read books on infertility, which will help them to be normal, and they can help you deal with stress. There will be stress reduction techniques such as meditations, yoga, progressive muscle relaxations, or acupuncture. Avoid taking too much of caffeine or other stimulant. Sorry. Exercise regularly to release physical and emotional tension. Stress management during the ICSI, it may slow down first embryo cleavage and accelerate embryo compaction. It is a randomized control trial. It shows that reduction in stress level retards first embryo cleavage and accelerates embryo compaction. And interestingly, it may also influence granulosa cell physiology and embryo development kinetics in participants with a good prognosis. Another study, it shows that stress and anxiety scores in first and repeat IVF cycle. A pilot study, it is showing that stress and anxiety level remains elevated across all cycles. Women with lower stress and anxiety level on the day prior to site retrieval has a higher pregnancy rate. This result emphasizes the need to investigate stress reduction modalities throughout the IVF cycle. Another study which is showing the prevalence of anxiety and depression among people with infertility, referring to Royan Institute in Tehran, in Iran. It is a cross-sectional study in which they are showing that anxiety and depression rates were very high among the infertile patients. To conclude, the stress has a significant negative role in infertility. It can cause infertility and have a negative outcome with IVF. Infertility treatment further causes stress to the individual. It can cause both male and female infertility. All couples must undergo counseling. They must receive safe and effective treatment for stress. IVF protocol must include anti-stress and anti-anxiety treatment in those couples. So now come to the management and its positive impact on the fertility treatment. This all we have seen. So what are the short-term goals for male and female fertility? Short-term goals for male and female patients are reduction of feeling of helplessness through coping with infertility, change in sexual behavior, modification of negative cognitions as to infertility, overcoming deficiencies in knowledge about fertility, and improving marital communication skills. The two main factors appear in chronic stress that determines which influences the condition and mood state in a couple on their fertility treatment is how the person handles their stress in general. And if that coping way is less than adequate, stress may become chronic, and chronic stress affects fertility. And the second factor refers to how the person handles the threat to his or her self-esteem or hurt to his biological and social value, which results from knowledge that something is with her or with his or her fertility. So, establishing stress levels before fertility treatment, like a physician other than the fertility clinic specialist, often the gynecologist, usually makes a preliminary diagnosis of infertility, and then they will refer to the IVF centers. So, the gynecologist should establish stress levels with the help of validated questionnaires or refer to a psychologist for this purpose to see if there is reason to suspect any chronic stress plays a significant role, or we can reduce that by some way of mode of treatment or counseling, and his finding will not yet to be affected by the additional stress produced by the visits to the fertility clinic. So what are the way to reduce the stress? like procedural means protocols that sorry, this is already we have done. So stress management, we can tell the patients to keep like doing physical activity either in the form of aerobic exercise. Okay, so this will have the benefit. One, like in few of the patients of PCOD, like even we all know since ages that even reduction in the small like 5% of weight also will affect the fertility. And second, it will reduce the stress and it will keep her busy. Second is listening to the pleasant music, whatever the patient likes, they can listen to the music and they will be feeling distressed. Doing the yoga, doing some muscle relaxation, and psychotherapy and cognitive behavioral therapy, they have to go for psychological treatment, or they need the proper counseling. They can keep busy herself by reading the books, and they can improve their knowledge also. Talk to their partner, support groups, and always tell the patients, like even we keep telling our patient, think positive. Like whenever they will ask the results, how much percentage will be the result, why you are thinking in the initial phase only negative? Try to think positive. Okay, so if our brain thinks positive, then only we will be getting the positive result. Avoid taking too much of caffeine and other stimulant that will again increases your level of anxiety. Try to go on holidays. So in summary, to manage, we also know that stress can make conception more difficult for men and women. While the exact mechanism of how this works is not totally understood, it is clear that there is a relationship between them. Finally, it has been demonstrated time and again that stress reduction techniques, when employed on a regular basis, can improve conception rate. So stress reduction is non-invasive, less expensive, and ethically acceptable way of improving fertility. The available evidence dictates that fertility treatment protocols should include stress management and stress reduction as a factor of major importance. The professionals in reproductive medicine should always test for chronic stress before initiating fertility treatment and adjust selection and treatment protocol accordingly. And relaxation techniques can reduce the stress score in infertile women as a complementary and alternative medicine. So last is some pharmacotherapy for the stress in IVF treatment. So already this we know, chronic stress releases cortisol level and how it affects the fertility and our brain pattern. So there are some medicines which are used for relieving this anxiety and stresses, like diazepam, alprazolam, lorazepam, clonazepam, and acetylzopram. These are not preferred by most of the gynecologists. These medicines are usually given by the psychiatrist. Benzodiazepines, these are the group of drugs which are used to treat anxiety and panic disorders, seizures, and insomnia. And there is no action in brain waves and hormonal pathway. It works only in the neuronal pathway. It binds to GABA receptor and increases the efficiency of GABA. We all know the types of GABA receptors. There are two, omega-1 and omega-2. Omega-1 causes sedation and omega-2 modulates stress and anxiety. So benzodiazepines, they binds to both omega-1 and omega-2 GABA receptors, and it relieves anxiety by binding to omega-2 GABA receptors and causes sedation by binding to omega-1 GABA receptors. So this is the side effect of benzodiazepines, that is causes sedation. So the limitations of benzodiazepines are anxiolytic and sedatives, and they don't have any action in the hormonal pathway and no action on the brain waves. So they will have some withdrawal symptoms like hangover, addiction, and tolerance. So what will be the ideal solution? So ideal solution will be to inhibit stress, that will be acting on the hormonal pathway, acting on the neuronal pathway, and acting on the brain waves, and that should not cause any sedation, no withdrawal, should not cause any withdrawal symptoms or addiction, or with minimal side effects or no side effects. See, basically we all know that why the babies, they will feel relaxed and sleep after mother's milk. This is the basic concept behind the newer drug, that is alpha casozepine. that is in the casein that is present in the mother's milk. In the babies, the infants, in their digestive system is not well developed, and this pepsin is mostly in the inactive form. So whenever and that will be acted upon by this activated trypsin, it will be converted into the alpha casozepine, and this is alpha casozepine, which is having the relaxing effect after the consumption of the milk by the babies. But we knows very well that this alpha casozepine is not not much formed in the adults, because in the gut of the adults, the casein from the milk, and in the adults, most of them, that pepsin is in the active form. So because of that active form, this activated trypsin, what is there, the casein is not getting converted into the alpha casozepine, that is not formed in the adults. So there is no relaxing effect. Not able to move my slide. Not able to move my slide.
Ma'am, you can reshare.
Yeah.
This.
Okay,
Okay.
Done. So what is it alpha casozepine? It is a decapeptide. It is present in hydrolyzed form. It has anxiolytic properties. So it displays an affinity to the GABA receptors, and it has a fairly similar structure to benzodiazepine. So a company called Ingradia, it develops alpha casozepine in an industrial level. The product name is Lactium, and that Lactium has toxicology data, animal data, and clinical data. So there are different studies which is done on Lactium. So that study, it is shown that anti-stress effect of Lactium on plasma cortisol in human healthy volunteers facing successive stress stimulation situations. In that, they have done a randomized double-blind placebo-controlled study, and total of 42 study group was there. In that, they have given first day 200 milligram of Lactin 2 times, and second day 200 in the morning, and in the placebo, they have given 200 milligram placebo instead of Lactium. So the evaluation parameters are taken, and in the another study, which was done by the BioFortis study, in that also they have given Lactium 300 milligram they have given, and it was double blind control trial, and they have done 300. They have given 300 milligram of Lactium per oral 42 days, and they have a visit at 15 days. So, and in that also they have parameters to assess the stress. So the results will be Lactium significantly reduces the stress level, that is TI score. And the other content is L-theanine, that is the active ingredient of green tea. It helps in relieving the stress by inducing a relaxing effect on stress level, but without causing drowsiness. And L-theanine is an amino acid which is known to block the binding of L-glutamic acid to glutamate receptors in the brain. L-theanine increases dopamine and serotonin production in the brain and induces relaxation through enhancement of alpha wave activity in the brain. So this is the mechanism of action of L-theanine. So there is a study which is showing that psychotropic effect of L-theanine and its clinical properties from the management of anxiety and stress to the potential use in schizophrenia. In that, they have shown that intake of 200 milligram of L-theanine at bedtime, it may improve sleep quality by anxiolytic rather than sedation. And its administration provides anxiolytic and stress reducing effects. Acute effect of L-theanine are observed few hours after its take, and its chronic effect also appears to be positive. No side effects or adverse effects of L-theanine supplementation at daily doses for up to 8 weeks. So this already I have told you that alpha casozepine, so it will that is Lactium. Okay, it will block the release of CRH, that is corticotropin releasing hormone. So from the pituitary, if it is less ACTH will be released. So there will be decreased production of cortisol from the adrenal cortex and adrenaline from the adrenal medulla. So it has been shown that 25% reduction in stress-induced cortisol level within 3 hours of consumption of alpha-casozepine. So role of alpha-casozepine is reduction of stress-induced cortisol level, and it also regulates the GnRH pulsality. So it will normalize the LH and FSH ratio. That is very important in the reproductive part. So in females, it will normalize the estrogen production, improves the oocyte quality, and it normalizes the progesterone production. And in males, it normalizes testosterone production and spermatogenesis. So this how it acts is it selectively binds to it selectively binds to omega 2 GABA receptors. So improves GABA activity, but it doesn't bind to omega 1 GABA receptors. So that's why there is no sedation. So this graph is showing how the alpha-casozepine is relieving the stress and anxiety, and another one it is showing it improves the sleep quality by the PSQI scale. So this is the article in which it is showing that L-theanine is a natural constituent in tea and its effect on the mental state. Evidence from the human EEG study show that it has direct effect on the brain. L-theanine significantly increases activity in the alpha frequency band, which indicates that it relaxes the mind without inducing drowsiness. So L-theanine role in brain waves, there is improvement in the alpha wave, that is good quality sleep. So it improves the fertility outcome. So to summarize, Lactium and L-theanine benefits in stress. It regulates hormonal pathway, it regulates neuronal pathway, and improvement in the alpha wave. In hormonal pathway, how it regulates it? It reduces stress and induces cortisol and adrenaline production. It regulates gonadotropin releasing hormone and gonadotropins, estrogen and testosterone, and so regulating the oogenesis and spermatogenesis and progesterone production. So, and also it improves the endometrial receptivity and regulate the libido. So overall, it improves the fertility outcome. And in the neuronal pathway, increases the GABA and decreases the glutamate activity, improving to cope up with the stress situation. And in the alpha wave improvement, it causes the good quality sleep. So overall, it increases the fertility outcome. So take home message is IVF specialists must acknowledge stress in infertile couple. So stress can cause infertility and have a negative outcome with IVF. Infertility treatment further causes stress. All couple must undergo counseling, must receive safe and effective treatment for stress. IVF specialists do not prefer pharmacotherapy. Alpha-casozepine and L-theanine combination is safe with proven efficacy to reduce stress. And IVF protocol include the begin with anti-stress and anti-anxiety treatment in couple. So it is very important to give the counseling, and counseling plays a very crucial role in infertility management to relieve the stress before starting the treatment. Thank you. Thank you for the patience listening.
Thank you so much, ma'am, for giving all the detailed and crisp information regarding stress and infertility and how to manage the stress for this issue. So we have recently launched a new product for stress management, and the product name is Aura Spa. So ma'am, can I play video for the product, ma'am?
Yeah, I'll now Mr. Nishant from Shield, he will tell you about this product in detail. Hand over to Mr. Nishant. Okay.
Thank you. Thank you, ma'am. Thank you so much, ma'am. So, 1 minute.
In today's world, stress and anxiety caused by many day-to-day factors lead to infertility, both in men and women. Chronic stress and anxiety have negative impact on 3 pathways:
In hormonal pathway, stress leads to the increased production of cortisol and adrenaline, leading to reduced insulin secretion and increased glucagon production. This triggers glycogenolysis and aggravates hyperglycemia. In men, high cortisol and adrenaline induces Leydig cell apoptosis, decreases testosterone level, and affects spermatogenesis and leads to loss of libido.
In women, it leads to irregular menstrual cycle, induction of granulosa cell apoptosis, affecting estradiol production and oocyte quality, decreasing libido.
Ultimately, the fertility outcome is affected.
In neuronal pathway, there is reduced GABA activity and decreased glutamate activity. This leads to failure of stress coping mechanism. Reduced GABA activity leads to inhibition of GnRH and impacts fertility outcome.
In the brain, stress induces the high beta waves, causing anxiety.
High stress impacts different stages like IVF preparation, oocyte retrieval, embryo transfer and pregnancy test, leading to reduced IVF success rate. Doctor, in essence, an ideal stress solution should work effectively in all the three pathways, be better and safer than benzodiazepines.
Have you ever wondered why after breastfeeding infants feel relaxed, calm, and sleep? It is not because of satiety. It is in fact on account of alpha-casozepine, Lactium, God's natural gift to infants, the natural stress solution. Alpha-casozepine is the original research of Ingredia, France, in collaboration with University of Nancy. In infants with partially developed digestive system, casein is converted to alpha-casozepine by trypsin. Alpha-casozepine calms the mind and makes the infant sleep.
Introducing God's gift to couple. Aura Spa, the oral spa, a calm way to conceive.
Each capsule of Aura Spa contains alpha-casozepine as Lactium 150 mg and LTheanine 100 mg. Aura Spa, the ideal and natural stress solution, acts on all three stress pathways: hormonal, neuronal, and brain waves.
In hormonal pathway, Aura Spa reduces stress-induced cortisol level in 3 hours. Hence, the GnRH is activated. In female, it prevents granulosa cell apoptosis, normalizes estradiol production, and improves oocyte quality. In male, it prevents Leydig cell apoptosis, normalizes testosterone level, and improves spermatogenesis. Thus, Aura Spa improves the fertility outcome.
In neuronal pathway, it increases coping mechanism and GABA, while decreasing glutamate activity. Stress levels are significantly reduced and sleep quality improved.
In the brain, L-theanine produces alpha waves and relieves stress and anxiety in 40 minutes. Aura Spa is approved with US FDA GRAS, Korea Food and Drug Administration, AFSSA. Dose: 1 capsule once a day for both the partners.
Aura Spa, God's gift to infants, is now available for couple. Calm to conceive and improve fertility outcome.
Thank you so much, ma'am, for giving your valuable time and for permitting us for sharing this video. So now let me check if we have any queries in the comment section. So Dr. Apeksha Thakre gave the feedback that the presentation was very nice, ma'am.
Thank you. Thank you, Apeksha.
Then Dr. Bhavani is asking that how to get rid of pain during sex, which also causes stress nowadays. So, what should be done?
Okay.
This is a question from Dr. Bhavani.
So actually cause of dyspareunia, that is pain during sex. There are different
Yes.
causes for dyspareunia. So simple will be like recently only I have one patient who they were recently married. Say they, in the mind they have the fear of sex. One I want to tell that we should give them the proper knowledge of the sex, like how to go for it. So to prevent the pain during sex, there are different things. Like we have to evaluate the cause of dyspareunia. Like it may be simple psychological, counseling the patient. Second, there may be some other factor like there may be imperforate like hymen, or there may be some other things like even the male factor, or there may be other causes like endometriosis. So we have to evaluate the patient. We have to take the proper history, evaluate, examine, and then do the proper counseling depending upon the cause of the pain during sex. That is dyspareunia.
Okay, ma'am. Thank you so much.
And
Let me check.
one question is there in my personal this thing. One doctor is asking, can we give this drug to the lactose intolerant? So yes, we can give this drug in the okay, na Dr. Ms.
Yes,
Nisha,
yes, yes.
we
It
can
can
give,
be
because
given.
I have seen that in that Lactium there is very less, that is 0.5% of lactose. So we can go for the even for the lactose intolerance also we can go for it.
Also, even for lactose intolerance, human can take up to 5 grams. I have read
5
somewhere.
grams, yeah.
Yeah.
So, but in
So
our
this is safe
this is
even
safe.
for
We can give.
lactose intolerant patients.
And
And it
Nishant,
is,
for how much
yes.
maximum duration we can we have to give this tablet?
So one capsule to both the couple for maximum 3 months.
Okay.
So, ma'am, any recommendation from your side for this product?
Yeah, I feel it is a good product because first of all, it doesn't have any side effects. See, whenever there is a drug, we are worried about the side effects. We don't want the long-term side effect, even for the short duration also. Like for relieving the stress, many of them they are taking the anti-anxiety pill in the night, but they will have their own side effects. They will cause the addiction and the sedation and other things also, withdrawal symptoms also.
Yes.
But so one thing is that it is there is no side effects with the drugs, and second, it can be safely used, and even the many studies and many doctors are using it, and they have the like satisfactory result of even their like IVF outcome is good with the there. So we can go for it. I
Thank you, ma'am.
feel it
Thank
we
you
can go
for
for it. There is, yeah.
Thank you, ma'am, for your valuable feedback. And I also thank all the participants who have joined for this webinar. And many thanks to Dr. Reeta Agarwal for giving their
Thank you.
valuable time and sparing their time on Shield Connect. And always, ma'am is participating in our Shield Connect webinars and also giving speech on all other topics also. So thank you so much, ma'am.
Thank you, Nishant. It is my pleasure to have with you all. And I would like to take further academic sessions because I am very much interested in
Sure,
academics.
ma'am.
So
Sure,
in future
definitely.
also, I would like to take the further lectures. Thank you so
Definitely,
much.
ma'am. We will be in contact.
Thank
Thank you,
you.
ma'am. Thank you,
Thank you,
Saiti.
ma'am. Thank
Thank
you,
you,
sir.
Sahiti, for your like all behind the behind the
Yeah.
scene work and till
He's behind
I
the
mean
scene hero.
yes. So thank you so much, Sahiti.